I'm JENIFER LOUSITO.
I'm Vanessa Paat, we're from Group 11. Management Control System and Service Organization. A management control system is a system that collects and uses information to evaluate the overall performance of different resources, where the type of control which will be suitable for particular firms depends upon the nature and complexities of operation.
A service organization is when people engage in a systematic effort, interact with customers, and to satisfy customer service requirements. Service organization refer to those organizations that produce and market intangible products.
The characteristics of service organizations. First, absence of inventory. Services cannot be stored. A key in most service organizations is the extent current capacity is matched with demand. This can be done by stimulating demand in off-peak period, is by marketing efforts and price concessions. Service organizations adjust the size of the workforce to anticipate demand by such measures as scheduling training activities in slack periods and compensating for long hours in busy periods with time of labor. Second, controlling quality. A service company cannot judge its product quality until the moment the service is rendered or felt by customers itself, and then the judgments are often subjective. Third, labor intensive. Most service companies are labor intensive and cannot use equipment and automate production lines by replacing labor and reducing costs. Like hospitals, to add expensive equipment, but mostly to provide better treatment, which increase costs. It's due the purpose of additional equipment to help the labor to produce better output, not to replace the labor itself. Fourth, multi-unit organizations. Some service organizations operate many units in various locations with relatively small units, like fast food restaurant chain, where some of units are owned and others operate under a franchise. Fifth, historical development. Such cost accounting statutory companies to file work in progress and finish goods investors for financial report. This system provides raw data for use in setting selling prices and for other management purposes. In public company financial report have to provide appropriately in order to maintain the investors and avoid sanction.
Types of service organization there are: first, professional service organization. Organization that produce particular service product or service produced by certain professional personnel. Research and development organization, law firms, accounting firms, healthcare organization, engineering firms, architectural firms are examples of organizations whose products are professional service. Financial service organization. Financial service organization is an institution that collects funds and invests them in financial assets. Financial service organization include commercial bank and thrift institution, insurance company, and security firms. These companies are in business primarily to manage money. Public account service. These organizations help their clients to maximize the efficiency in their financial management. Healthcare organization. Healthcare organizations are organizations established to meet the health needs of the community. Healthcare organization consists of hospital, clinic, health maintenance organization, nursing home, home care organization, and medical laboratories. Non-profit organization. An organization that the operational and purpose is not to get returns, but to support in solving problems that often occur in community. The main goals of non-profit organization is defined by their mission. The managers of non-profit organization are in charge of designing a proper system of management control to ensure effective and efficient use of resources.
The company introduction. BPJS Health, or we know Badan Penyelenggara Jaminan Sosial, is a public legal entity that has the responsibility and has the task of administering national health insurance for all Indonesian people. The services include examination, treatment, medical consultation to the doctor, labor, ambulance, and so on. The problem is the organization had an inefficient project management process. The National Health Insurance Service Program that BPJS participant feels is not optimal. This is indicated by the accumulations of BPJS patients resulting in long queue for treatment at the hospital, which is caused by health service providers' lack of resources, weak infrastructures, and geographical conditions in an area where patients cannot reach these health services in several areas. Meanwhile, health services such as the availability of cardiologists, cath lab, or other services can be got by patients by following many procedures if there is no availability in their area, and make it an inefficient process and even accumulations in other hospitals. The management process to be inefficient is also caused by fraud committed by organizational staff and BPJS participants itself. The absence of a specific anti-fraud policy has resulted in no definite direction of all institutional staff and anti-fraud teams to execute the fraud control programs and result in less than optimal programs that are already running. This situation will further have an impact on increasing fraud cases. The fraud that occurred in BPJS program was very detrimental, not only to BPJS Health and its participants, but also to the state. As a result of fraud, BPJS Health pays claims that are higher than the actual cost. In addition, there is a loss to the state.
Solution. The things that should be considered in increasing efficiency in organizational management. Conduct research. To encourage the system, further research is needed regarding the transparency and accountability system, especially in the presentation of data and the program or policy that will be formed. Thus, all parties involved in the organization have the same perception in monitoring activity. Education and training program. Educating the things that need attention in service organization is an important stage in building a culture of integrity in organization that can improve service quality. The education and training program provide athletes include regulation, understanding, coding, reporting, detection technique, and fraud investigation technique. Evaluation. It needs to be accompanied by an evaluation to ensure that all parties are properly educated. In evaluating, it's necessary to explain the things that need to be done to achieve each goal in optimizing the work performance of service organization. Evaluate service quality to meet customer satisfaction and plan to improve service quality, as well as improve management process within the organization to be more efficient. Consumer portals. Service organization provide consumer portals to interact directly with the organization efficient, especially in healthcare organization for those with geographic problems. And service organization driven by loyalty and satisfaction are turning to more convenience and real-time tools to engage with customers. Conclusion. The conclusion is that the quality of organizational service also depends on good behavioral of organization staff and participant, and an implementing strategy or system and facilitation needs to be improved within the organization, including strengthening the leadership role of the various institutions involved. Moreover, clear regulation and aggravating punishment is effective to minimize the infringement.
The suggestion is that service organizations search for better systems, strategies, and do evaluations for improving its measurement is likely to be eminently worthwhile in order to improve management process and communications in organizations, as well as conduct socialization and education regularly for all parties in the organizations who play a role in optimally running the program. That's all about our presentation. Thank you.